thank you for joining us today to this first webinar of the new autumn edition, the Health and Risk Communication webinar series. I'm Dr. Marco Bardos. I'm the convener of this network, and I'm very pleased to have today Professor Emma Boyland from Liverpool. Emma is a researcher interested in understanding the extent, the nature, and the impact of food and beverage marketing on eating behaviors, and particularly in children. I'm reading from your website, Emma. Her work includes monitoring activity and food marketing across various media and settings. And basically today, she's going to talk about her research experience in the last few years, looking at the misleading health communication by the food industry. So without much further ado, I'll let Professor Boyland talk to us. Thank you.
Thanks very much. Thanks for the invitation. I'm delighted to be here today to talk about this issue about how the food industry communicate with us in relation to their brands and their products, and how that can be misleading in terms of health. I'll dive right in. So I thought it'd be useful to start with kind of why do we care? The so what of the story is that, of course, in the UK, as in many Western populations, we're all consuming a diet that's poor in terms of nutrients, and that's largely made up of excess, unhealthy, or UPF foods. That leads us to be suffering from both excess of BMI and rising rates of obesity, but also nutritional deficiencies as well. And those are both independently and collectively associated with poorer health outcomes, from things like stunting and poor growth through to all of those comorbidities that we know about with obesity, such as diabetes and cancer and so on, and ultimately poor health outcomes and premature mortality. And the proposal of this sort of field of work and what we're exploring is the role of marketing, particularly in this case food, but also deal with some examples from the alcohol field as well. But the role of marketing in driving these dietary behaviours that lead to these poor health outcomes. And the WHO define marketing in quite a broad way. It refers to this sort of commercial communication, message, or action. So it's quite broad and captures anything that seeks to or has the effect of increasing recognition, appeal, and or consumption of products. And what we're really interested in when we're exploring the impacts of food marketing, and that I'm going to go into later, is what's happening in this point. How is it that marketing communicates with us in a way that drives changes in beliefs, attitudes, and ultimately in behaviours? And as I say, you can make a sort of similar case for any of these things with alcohol, smoking, and gambling as well, in that they have slightly different impacts and outcomes, but largely they're influenced also by marketing, and the end point has public health consequences. I think it's important as well to position this quite broadly and situate it within this bigger context, whereby the industry is creating the food system and has a lot of dominance over the food system. So we know that transnational corporations are really the sort of big players in the global food system, and they get to drive anything from the production to the distribution and everything in between in that food chain in a way that suits their purposes. So they have this production at scale, they have distribution at scale as well. And these are all largely producing these ultra-processed foods that are very low cost to produce, but can be sold at a big profit. And because there are so many competing brands and product lines, then of course that brings in the need for marketing so that they're able to differentiate their offering from that of competitors. And operating at scale like this means that they've got the resource reduction in terms of production with that big profit margin that they can then invest a lot into not only creating new products, but also getting them on the market and getting us knowing about them as well. And you've probably seen something similar to that mapping on the right there of before, of kind of the big businesses and just the number of brands within their portfolio. So what we think of as quite a diverse set of brands and items might actually often be owned by the same kind of umbrella corporation that have all of these powers. And they don't just do marketing and advertising and promotion and sponsorship activities, although that is largely what I'll be talking about because that's my kind of area of speciality. But they also do these other actions as well that enable them to continue holding this dominance over the food system and communicating with us, with the public, with legislators in such a way as kind of to maintain that position and maintain the status quo and that level of influence over our behaviours. So I'm just going to bring up some examples of each of these things just to sort of situate the other work in that context. So you've probably all seen stuff about how the food industry lobbies against public health policies. So they will submit very lengthy, very glossy and well-prepared responses to any consultation that governments put out. We've seen examples of this in the UK. Obviously, it's not always sort of publicly apparent that this is happening, but on occasions like this, there are opportunities to look at how this is happening behind the scenes, and that they will be using the benefit of these very well-resourced large corporations with big kind of legal teams and so on to put in really quite convincing responses to these consultations, and contrast that with kind of academics trying to scurry together to put something together in the limited time that they might have. And think about how persuasive that can be as a form of communication for policymakers. And also companies will use corporate social responsibility campaigns as well to really communicate something about their brand that puts them in a positive framing for the general public. So just picking the two leading beverage brands there as an example. Coca-Cola have a Live Positively campaign, which is all about using plant-based bottles, recycling, sustainable production, limited water use and all that kind of thing, that positions them as part of the solution rather than the problem. And Pepsi have this, or had this refresh project that was about having, I think it was $20 million that they would then awarding grants to individuals, businesses, or kind of groups who are doing something that would that they thought would have a positive impact on the community or the country and so on. And so all of this is kind of used as a way to increase the positive beliefs about particular brands, and also in a more sophisticated way to shift the narrative around problems as well, that I'll come to again in a second. But a number of years ago, Coca-Cola funded what was called the Global Energy Balance Network. And the idea of that was to really shift the focus of the story, not onto food intake and energy intake and how that might be driving problems, but more, making it all about energy expenditure. And, the reason obesity is rising was because we've all got reduced energy expenditure because of automation of household tasks, and we're not exercising enough and so on, to sort of shift the responsibility away from their products and their role in that food environment. We also see industry and industry sort of collective groups using the mass media as a way of deploying arguments against policies. So they'll set out their case for why a policy is not needed, why it won't work, essentially why the problem does not lie at the door of the companies that are producing harmful commodities such as food and beverages. We see that a lot as well. It's a persuasive form of communication. And within that, there's often the case that the industry will frame the problem and the solution very differently to the way it's being communicated through kind of evidence-based public health groups, for example. So again, here's an example from alcohol, but you could say the same about the framing of the debate around food often as well. But here the example being that the industry will frame the problem of excess alcohol and its health effects as being a sort of a limited issue that relates to people with problematic relationships with alcohol, for example, binge drinkers, or alcohol dependent individuals, and that it's nothing to do with their pricing of alcohol, making it available, accessible and affordable, and it's not about their marketing of the product either. And actually, you know, the solution doesn't lie in limiting those things. It lies in addressing those kind of unique behavioural, you know, limitations of people, and that can be a very powerful message as well. So we do need to be mindful of the fact that they do this. They also create an illusion of support. So this also ties into a bit of what I said about the global energy balance network as well, because Coca-Cola would fund people to conduct research that would find that, you know, their products weren't a problem in terms of consumption or health, or that marketing doesn't work and doesn't increase consumption, for example. And what we know from a series of systematic reviews and meta-analyses and so on is that there is a relationship between the funding source and the conclusions and outcomes of reviews and studies within those reviews. So that, you know, if it's funded by an industry, it's more likely to show bias and have findings that are in favour of their products, or have this kind of industry-leaning narrative as the final conclusion. And in that way, create this idea that there's a very mixed body of evidence and we can't be sure whether there really is any harm or not. So sort of, you know, creating this idea that it's an unclear evidence base. And these are all actions that communicate to policymakers that, you know, fight against what the public health community is saying. They also not only kind of create that idea that they have support for their position, but they also take any opportunity to undermine public health science as well. I've seen this a lot with my own particular work around food advertising and marketing. So it's a sort of classic story of not just saying that the policy won't work, but saying that the evidence that informed such a policy has, you know, these really critical limitations that mean that it shouldn't be relied upon to inform policy action. It's not to say, you know, that we're not accepting that all research has limitations, but that, you know, often these will be holding scientific studies to a much higher burden of proof or sort of expectation around what it can do, that they wouldn't apply to their own points and any support that they may have for those. So that these things are all kind of part of that overall package of what WHO would capture under the umbrella term of marketing. And it does matter that corporations do this. It's sort of, you know, it's easy to think that we can just sit here and create a strong evidence base and that will be enough. But actually, it really does interfere with public health policy making when there is this confusion of health communication. And often, you know, some of that stuff in the mass media can put doubts in the public's mind, or have the public think that, you know, there are different reasons for there being a problem with diet and obesity than we might review from the literature. And if, you know, policymakers aren't going to implement policies if they think they're deeply unpopular with the public, because of course that has implications for, you know, how the public are going to vote and then retaining power and so on. And so it's important that we think about not only the science that we're creating, but how we're getting the word out. And, you know, that all of this kind of communication coming directly from those industries themselves does create doubt in the mind of policymakers, that then it's kind of, you know, part of the challenge for an academic trying to translate evidence into policy is how to combat those sort of competing effects. But shifting into food marketing itself now, the WHO have this framework that sets out what the kind of critical aspects are of food marketing that we need to be thinking about. And they have them called exposure, power, and then impact. And exposure is quite obvious. It's how much exposure we have to food and beverage marketing. I'll just say food marketing throughout because it's easier. But it means kind of how many people are seeing messages, how often are they seeing them, and what types of products are being marketed. And then the power of marketing is that kind of persuasive power, and, you know, things about the creative content of the messaging and how that's used to, you know, grab our attention, hold our attention, and persuade us to, you know, behave in a particular way. So the behavioural impact being, you know, greater choice, greater preference of those items, purchasing and consumption of those items, and so on. So I'm going to touch on all of those things in the body of this presentation. A lot of the evidence as well is focused around children, and there's a lot of policy action that focuses on sort of the protection of children. And one reason for that being, of course, it's much sort of easier, I guess, as a political argument to say that you want to protect children. That's, you know, it's difficult for anyone to argue against the fact that children deserve protection. But it's also partly based on quite dated psychological models as well that suggested that children are particularly vulnerable because of their limited cognitive development. So of course children do have immature neurocognition, that's not in doubt, but whether that makes any difference for food marketing is sort of unclear and not really supported by the evidence. So these models are largely derived from when TV advertising was the only real kind of mass source of exposure for children. And some studies showed that there were different stages of understanding of TV advertising and what it was doing, and they're set out there on the left-hand side. So it's kind of goes from pre-recognition, where very young children can't distinguish between the advertising and the programming, to intermission intent, which is an adorable phase where children think that it's a break for the actors to go to the toilet and so on, through to the most sophisticated understanding, which is of persuasive intent. So that's understanding that marketers will communicate positive attributes about a product and withhold negative information in order to be persuasive. But as I say, most of this was done based on TV advertising, and that's a very different beast of what we have now. We do still have TV advertising, and it's very distinct, isn't it? You see that there's an ad break. They're generally sort of 30 seconds long, and they can be visually quite different. So you could be watching a cartoon, and then an advert comes up that uses kind of real people, and that's quite, you know, that's a clear cue for young people that this is different. But with digital, it's much more difficult because the advertising is really embedded in the entertainment content a lot of the time, and those cues don't exist in the same way. But as I say, more recent evidence just suggests that there's no real difference in terms of how impactful advertising is based on our understanding. So teenagers will fully understand that advertising is there to sell us stuff, and it does that in a number of different ways. But that doesn't mean that they're able to kind of resist and protect themselves, and I'm sure adults aren't either, although there's not so much data on adults. And it's important to think about the fact that younger children and teenagers are both vulnerable, but in different ways. So a lack of understanding may mean that younger children are sort of absorbing information without critical viewing, but then teenagers might be able to critically view, but also are more vulnerable to things like emotional messaging and messages that indicate that foods and brands will support kind of social positioning, because that's a really salient thing for teenagers, and so on. And obviously teens are also a very risk-taking demographic and unlikely to be thinking about kind of long-term health promotion. So it's important to consider teens in this as well. If we think about where young people and all of us see food marketing, just in our sort of day-to-day lives, it's pretty overwhelming, the number of ways and situations and settings in which we would see messaging about kind of food and what is a typical diet, or if you know the advertised diet. So you know, at the beginning at the cinema, when we're waiting at the bus stop, you know, stuff comes up on when you're on social media, either just a sort of generic advert linking unhealthy commodities to sport that we'll come back to later. You know, claiming Coca-Cola claiming Christmas, Haribo in a rival move also claiming Christmas. You know, on the back of bikes that may also be delivering food for, you know, Just Eat or Deliveroo, for example. In Snapchat, that is me as a chicken nugget, looking disgruntled chicken nugget. And, you know, even you're getting money out of an ATM or a cash machine, and there's advertising both on the screen itself and on receipts that may be served up through the machine. And I saw an advert, a digital screen on a petrol pump as well the other day that was also serving up advertising. So it's pretty relentless in our everyday lives. Going through the Merseyrail barrier at my local station as well, extra opportunity to advertise unhealthy stuff. We can broadly package these into sort of categories, meaning like traditional advertising on the left there and digital on the right, although increasingly they're blurred because, of course, a lot of outdoor advertising now uses digital displays as well as paper ones. But even within digital, it's also developing and changing over time pretty quickly as well. And a lot of the early studies on digital ad exposure were looking at things like advogames. As you can see there, the Oreo one in the top left of that little grid was essentially kind of interesting, but not too overly complex online games that children could play for free. And there would be exposure to the brand throughout. Either, you can see the logos on there, or the game pieces would be have the logo on them and so on. So it's a kind of more, the concern was that this was a more persistent type of exposure compared to what we'd get in a kind of 30-second TV ad. But that's only got more worrisome over time as digital marketing has expanded into a number of different digital spaces, including where you have to watch an ad to get points in a game or to allow you to move to the next level, for example, or within game streaming, and so on and so on. And so it's essentially inescapable online as well as in the physical environment. And there are studies and reports from academics and independently, but also working with groups like UNICEF and WHO that have kind of mapped the prevalence of advertising in all these spaces and found it to be, comprehensively present in all of these places to a greater or lesser extent, but largely unavoidable for any child who uses any of these devices and media. And we know children are very often present in all the different media settings, particularly new media. And the concern with digital is, as I said, it's sort of about how it's embedded in the entertainment content. So the communication becomes kind of, with an influencer or something, becomes a natural endorsement versus the sort of messaging that only comes directly from the brands, as you would see in a TV ad. But the other concern is the nature of targeted marketing that happens through digital platforms and digital devices. And this is because the internet is based on this system of programmatic ad delivery. So essentially that when we interact with a digital space on our device, all of that digital footprint that's been collected about us through our previous presence in those spaces and our behaviours in those spaces is held by third parties and used to inform a buying and selling process that happens in milliseconds behind the scenes to determine what ad to be served to you. And it means that when we look at digital spaces, we see a curated version of advertising that is designed to be, the stuff that we're most likely to respond to, delivered to our devices in the moments when we're most likely to respond, whether that's based on sort of geolocation data showing that you're near, for example, a fast food chain, and you'll be hit with more fast food advertising by that brand, or based on timing. So, for example, targeting parents at a time when children might have just gone to bed and they might be more likely to think, oh, I don't have time to cook, I'm going to order out. So kind of that unique ability of digital to really sort of hit us when it's most likely to lead to sales is what's most worrying. And it's very, very well resourced and is only going to get more so. So investment in digital marketing is going up and up each year. And it's relatively cheap compared to TV and other sources as well, because it's essentially, there's infinite space for it. And so we can expect that this investment will continue and diversify. And sort of the next level of this is that we're, thinking about how brands communicate with us and tell us about their products that we know are largely harmful to health, is that, imagine that we're living in this this physical food environment that's sort of dominated by the presence of unhealthy, fast food brands, some people living in food deserts where it's really difficult to get fruit and veg. And then also alongside that, these immersive digital worlds that we might live in, the metaverse and so on, that, young people might spend a lot of time in these environments, and all of the brands are already there and ready to make sure that, you could be sitting on a little bench that's shaped like a Pringle. And what does that tell us about normalizing those sorts of products in our diets? Another trend in how the food marketing and the food industry are communicating with us is to really push the brand and do marketing that is brand only. So that's using things like logos and strap lines and so on, without showing actually the product that they're marketing. It's thought to be a growing strategy in response to restrictions that are based on working out how healthy the product is, and then it can or cannot be advertised. So they're sort of circumventing that, or circumnavigating that, by using these kind of brand only strategies that really muddy the waters as to whether it's healthy or not. And you can see a couple of examples there. It also lends itself to other forms of marketing that are very much about telling us something about the brand rather than about any specific product. And you see a lot more of this surrogate marketing, I think, in the alcohol space rather than food, but it does also exist in food. And some of you might be familiar with this change over time of the Coke Zero, for example, from being the black can that was quite distinct from the original red to now it's very difficult to tell at a distance whether it's the kind of full sugar or the zero sugar product. So it's kind of a coming together of the full range. So they want you to care less about which individual product you're consuming, and just they want you to be a purchaser of Coca-Cola. And so they're kind of creating that brand identity that's really across the portfolio rather than by product. And we also see this alibi marketing as well, where companies can get around policies that are based on the product by not even showing particularly the brand, but actually just like a strap line. And Carlsberg have previously used just the word probably on the borders around football pitches, for example. So they don't even need to use the full name. They can just say probably with the tail that has the brand logo element to it. And McDonald's are so kind of embedded in our consciousness now that they can just list in McDonald's colours the constituents of a burger, and that can serve as an advertisement for the full range. McDonald's is the example here, but we could use any other one. The idea of all of this marketing is to create these kind of implicit and emotional associations, so that without even really thinking, kind of top of mind, we would associate McDonald's with these things. Obviously, shifting over time, it's less about Ronald McDonald these days, and they've changed the colours from that kind of red and yellow dominance to those more kind of muted colours that we saw on that ad just then with the different items in the burger. So they kind of, they want us to think McDonald's and think sustainable, and this is exactly the purpose of marketing, is to create these positive associations in our minds. So they're using all of this brand stuff, but when they do advertise products, there are a number of different studies that have looked at this, and although the specific percentage that are unhealthy vary, it's always typically that a majority of the products advertised in any space are unhealthy or ultra processed, or by whatever metric health is determined. And that's not surprising when you see, the leading categories of food ads are things like sugary beverages, including energy drinks, fast food, sugary breakfast cereals, snacks and confectionery. And we do see that there are differences in exposure by sex often. So boys will often report greater exposure to food marketing than girls. We can also see differences by socioeconomic status as well, although they're largely driven by differences in screen time rather than by prevalence of marketing. Except in the outdoor space, when there are, the studies showing that there's greater food marketing in kind of physical environments that are more deprived, and also differences by ethnicity as well. But there's yet to be any convincing evidence that those groups differ in their response to food marketing, so that they have a kind of unique vulnerability above and beyond the fact that they have greater exposure in the first place. And in terms of kind of the health communication element of this specifically, despite the fact that most of the products being advertised are unhealthy, we actually see quite a lot of use of health and nutrition claims in food advertising. So health claims being things like this can help create strong bones and teeth, and nutrition claims being things like low in fat or high in fibre and so on. And they happen quite a lot. And that speaks to that thing about, highlighting positive attributes and leaving the other ones. So, Nutella will be advertised as having 1.5 glasses of milk in it, so that they can make those, claims, but they won't mention the amount of sugar in them. And same for things like, I think child yogurts are quite a good example of that. Things like Petit Filou will talk about strong bones and teeth and not mention the overall kind of nutritional profile of many of the products. And so food advertising works very well to convince us that these products are not only fun and tasty and enjoyable, but actually a healthy choice as well. And they do this in a number of different ways, not always through that kind of explicit health claim messaging, but more subtle things like, so for example, unhealthy cereals will quite often be portrayed on a breakfast table with fruit all around it. And that goes for a number of different products as well. So there'll be the actual product being promoted will be shown in an environment that contains a lot of, visually a lot of healthy foods alongside it to kind of create this health halo effect. And we also see that done in a number of different ways in food ads. So we've got some examples there. The red one is obviously Coca-Cola. It says, live like grandpa did, move more, eat well, take it easy. So it's suggesting that it's fine to consume their products as long as you're moving and eating well in a general sense. And also the one on the right, the kids running around in the garden, was from a McDonald's Happy Meal advert. So it's essentially kind of creating this idea that these are happy, healthy, physically active children, and a Happy Meal sits within that kind of healthy context. Mentioned before that food advertising is commonplace in sports media as well, and this happens from kind of grassroots level all the way through to the top of the professional game, and there's a couple of examples there, but in common with that kind of idea of everything switching to digital and that being the growth space, we're seeing a lot more food marketing in the esport arenas as well. Often things like energy drinks and snacks that are being marketed as a kind of way to boost your energy and maintain your sports performance. So it's kind of adding, get you better stamina to play the game for that bit longer. So it's in esports, but also more broadly in gaming networks as well. And it's a particular problem when it's linked with sports, because this does create this sort of paradox of, I think we know deep down that, leading athletes are not consuming these sorts of products, but it gives it that air of health that perhaps the products often don't deserve. And this is an example of an experimental study that showed that when parents see nutrient claims or see sports endorsers on food packaging, they're more likely to think that that product is healthy, they're more likely to choose it for their child and intend to purchase it later. So it does have implications for our behavioural response, and not just children directly, but also via parents as a gatekeeper. I wanted to include this as another example of a kind of a health cue or a cue used by the food industry that has implications for health. So studies have looked at the volume of cereal presented on the front of cereal boxes. So I don't know if any of you have ever bought those kind of multi-pack 30-gram boxes. That reminds me of kind of scout and guide camp as a kid. But you'd pour that into the bowl, and it looks like a small amount relative to what you see on the front of cereal boxes, where the cereal is bursting out of the bowl. And it was assessed that those are often, much larger than the recommended serving size, and would be, a real excess of intake for a child. And children still use cues like on packaging as part of kind of, you know, their observance of the world. So they're not only looking at what other people do, but cues that are available to them to indicate what a reasonable portion size is. So we did a study where we presented children with kind of mocked up cereal boxes that either had the recommended serving size of 30 grams on the front, or the kind of more typical serving that you would see where the cereal is actually kind of bigger than the bowl. And with when they were given the bigger box, or the box with the bigger portion on it, children served themselves more and consumed more as well. So it's another kind of cue that we need to be mindful of on food packaging itself. And we need to be mindful of all of these things because we've got robust evidence that food advertising increases children's choice of advertised items and of less healthy items altogether, increases their preference for those items and for their associated brands, and it affects their immediate intake. So it's significantly increased. And this has been shown time and time again. And I guess one criticism that the industry will often use in their kind of responses against public health policies in this space are that we don't have direct evidence that food marketing causes child obesity. It will never be possible to do a randomized controlled trial of this. Where do you get the control group that don't see marketing? You know, and we all know, you know, weight gain happens over time. But what we have been able to show is that this relationship meets the epidemiological criteria for causality, so that we can be confident that, you know, even in the absence of this direct evidence, it's a strong enough association. It meets all of those criteria to say that it's a causal factor. Not the only one, but one that we need to deal with. And in terms of policy implications for that, we've been able to use all of the evidence that of how much advertising there is and what impact it has on eating to model what restrictive policies would achieve. And we've done this for the 9 o'clock watershed that we're hoping will be introduced in early January next year after many delays. And our modelling suggests that this will be impactful at reducing child overweight and obesity, and also have a greater impact in the more deprived households than the less deprived. So it should help reduce health inequalities and also produce these health-related net monetary benefits to society. And in terms of the design of policies and what effective approaches might be, in the UK, we're full steam ahead with mandatory approaches now, but that's not the case in many countries that are still relying on industry self-regulation. But I was commissioned by WHO to look at not only the evidence of what food marketing does to food behaviours, but also to look at the effectiveness of implemented policies. And this diagram shows the kind of outcome of that assessment. Each of the blue boxes is one study, and the darker blue is the higher quality studies. And what this shows is that against all the key indicators, like how much marketing is there, you know, how much reformulation has been achieved by this policy, and so on. The mandatory policies tended to sit in the area where there was a clear effect showing that the mandatory policy had had a positive effect on these outcomes. And that was the case that the stronger studies were over there as well. Whereas when you look at voluntary measures, so industry regulating itself, we see that most of the evidence suggests that the studies are all sitting to the right-hand side, which means that the policy didn't achieve anything and in some cases made things worse. So it's really strong evidence to show that, you know, it really needs to be governments taking the initiative to make a meaningful difference to these outcomes. And that underpinned the global guidelines on food marketing that were released a couple of years ago now, that really pushed forward what WHO was saying compared to the similar recommendations in 2010, to say that, you know, they really need to restrict marketing of unhealthy products to protect children in particular, but children of all ages, and that those policies should be mandatory and use government-led evidence-based approaches, as well as everything else, such as restricting the power of marketing. So things like promotional characters and so on should be included. I'll wrap up now, but just to say that there are a number of kind of ongoing challenges in trying to tackle what might, how do we create a kind of healthy system of communication around food, particularly in relation to food marketing. And there's a lot of difficulty, particularly with digital, because it crosses borders, so it's not easily dealt with at a national level, and also how to place or where to place the liability around what gets delivered. Is it the food industry? Is it the media platforms? Is it the publishers of that content? And how we might generate effective sanctions when we're dealing with sort of platforms that have, I guess, more financial power than the governments that might seek to regulate them. So there's a number of issues, but I think we've made progress in terms of overcoming the reliance on industry codes of practice, and only dealing with marketing directed to children rather than marketing that they are exposed to. So there are some positive signs for all of these efforts over the years. But I'll finish there. Thank you very much for your attention, and I'm happy to discuss any and everything. Thank you.
Excellent. Thank you very much, Professor Boyland, for this very insightful presentation. I think we can take some questions from the audience. You're free to raise your hand. I think we can let you speak if you want, or you can type in the chat. I can see one question here from Jenna. I can read it out loud. Really interesting. Thank you. How do you anticipate new regulations might change where companies direct the marketing, for example, a rise in out-of-home ads or new tactics?
Well, there's a lot of work going on in this space. I think a number of you might be involved with some of the projects looking at kind of local authority policies around food advertising. So obviously, depending on what property they own, that can cover things like council buildings, leisure centres, bus shelters, and so on. And there's a lot of work to be done being done to map out where these advertising boards sit outdoors and who owns that space, and what the interplay might be between local and national policies. And I think the key challenge there is around the digital spaces. And so not only, as I say, you have this issue of cross-border marketing, but you also have the issue of kind of rotating screens. That what's meant to be coming next is that in itself can be targeted as well. So you can have things like cameras above the infrastructure that is then looking at individuals and profiling them in certain ways, so that you get different marketing for the commuter crowd than you would for an evening leisure crowd. And so I think there are real challenges, both with the kind of power of local authorities, and we really need the government, I think, to step in that space.
Thank you. There are other questions? If not, I have one. I mean, one of many, I would say. The first one, so what can we do as researchers, activists, public health professionals to counter this marketing? I mean, are there more ways we can do it besides influencing policymakers?
Yeah, I mean, I think it's there are a lot of challenges for local people in positions of power. So, for example, head teachers can have a real conversation about what's appropriate in terms of allowing sponsorship of breakfast clubs or sporting equipment or so on. A lot of these people are often struggling in terms of the finances, which is where the real challenge comes in. But if we think longer term about children's health and the health impacts and health costs of getting that messaging coming to children very early on, that McDonald's is about fun and sports, and what that means for their lifelong kind of affiliation and purchasing from that brand, for example. So I think there are things that people in those sorts of positions can do to mitigate the effects. And I'm not a big proponent of kind of critical literacy here. So as I set out before, I don't think understanding it means that you can reject it so much. But that being said, it's not going to do any harm to have children be critical viewers of that content, as we would want them to be for anything that they see online, from the news to this kind of thing. So I think having those conversations with children does make them more aware. You can imagine what my kids are like about this kind of stuff. And it drilled into them since they were born, and they often give me useful examples for talks when they show me the screens that they have. So I think there's a place for parents to have that conversation that will support the additional actions as well.
Okay, thank you. Yeah, my way of thinking was around critical media literacy, particularly about educating people how to interpret ads and say this is ads, but they are becoming a bit more, the ads are becoming a bit more blurred. I think that there's a lot of difference between what it's a paid advertisement and what is not. So what is called below the line in advertisement jargon. So something that is a paid event and sponsorship, and people might not understand the differences between that. They say, well, it's out there. I'm not sure if it is, I can trust it. And then there's a role of influencers, social media influencers, particularly. They may not declare they are sponsoring a product because they've been paid for.
Yeah.
So there's a lot of regulation that could go in that direction as well.
Yeah, it's very difficult to identify. And I don't think the solution lies in kind of restricting young people's use of that space either. I mean, there's obviously an argument for, reasonable amount of screen use. Obviously, it's, no one's favour to be permanently on screens. But I don't think the answer is to say, children shouldn't be online for more than X amount of minutes per day and so on, because it's not realistic, but it's also not fair, because there are also a lot of positive benefits to that online accessibility, education and social interaction and so on. So my emphasis has always been on kind of making those spaces safer for children to spend time in, rather than taking them out of those spaces.
Yeah. You touched also the problems of regulating advertisement when it comes to social media. When you have giants like Google, Facebook, or Meta, Alphabet that are controlling, they're not based in this country, they are based somewhere else. So they go by different rules, right? How would you overcome this problem? What do you think would be a solution?
Well, it'll be interesting to see what happens if and when the UK bring in these regulations in early January. So anyone who's been following this will know that it was originally meant to happen in 2022, and has been pushed back a few times. But the premise of the UK legislation is that companies that are UK operating businesses are not able to advertise in a paid way. So that comes back to your point before, online at any time. So it's not trying to limit it to kind of align with TV. It's saying at any time it's inappropriate for that to happen. And so that's effectively doing what you say. It's regulating the internet, which is a global cross-border media, but in a way that isolates it down to what matters in terms of UK operating businesses. So stuff where we would be able to access the food that's being marketed, but also within those categories, the categories of food that are, of concern around children's diets. So it's really, I think it has its limitations. It doesn't cover brand marketing. There will no doubt be a lot of things that need kind of tightening up later, but it's a good first step in kind of testing that notion of what can be done by national governments, despite it not being entirely within their, jurisdiction.
Right, thank you. We have two more questions from the chat. So from Kate, do you have any advice for local authority public health teams in trying to convince their lead council members when advertising space is a critical form of income? That's an interesting one.
Yeah, my first bit of advice would be always to speak to Fran Bernhardt at Sustain, because she is the absolute guru of all of this and has supported all of the council or local authorities that have taken action on this so far. So anything you need, Fran will know. But also, I think that there is a report due out from the Sustain group to show that those that have implemented restrictive policies have not seen a loss of income, which is an absolute key point. So the economics is always, at the heart of any of these decisions, whether it's local authorities or national government. So there's plenty of stuff that can be advertised that isn't food. There's plenty of other commercial commodities. And it seems that where it's happened so far, other commodities have stepped up to be advertised. I mean, there's a whole other argument about whether we should be commercializing our lives this much at all, but focusing just on food and beverages, it seems that it's possible to do it without that loss of income. So yeah.
Right, thank you. And then another question probably is going to be our last if we don't have any burning questions more. Michelle, fascinating talk. Thank you. Policy changes are clearly key, but so is educating the public on many of the tactics used. Therefore, I just wonder if there's anything you could add on this. Thank you.
Thank you. Yeah, I mean, I think that there's the issue with convincing the public that this is an issue is that everybody feels sort of like that nanny state argument that, you know, we don't need to have these things taken away. No one likes to feel that they're being manipulated or that their behavior is anything other than free choice. And that often, you know, everybody has personal and emotional relationships with these brands. So, you know, that there are many different things like nostalgia for a brand that you consumed as a child or something your parents always used to give you or whatever. And these are very strong emotional connections. It's very difficult to tell somebody, actually, that brand is not your friend. They're not doing you any favors and so on. And so, yeah, I think that there's a lot that could be done with education to try to kind of break that and show them, you know, the truth of those behaviors and what impact it's having. But yeah, it sits alongside a number of other public health things that I think we tend to resist initially, like, you know, I don't want to have to put my seatbelt on every time I get in the car, but ultimately we recognize the, you know, the health benefits in the long run.
Yeah, excellent. This, I think, brings me the discussion about public health branding. So there's a stream of research probably coming from the United States. I know particularly one professor that is doing this in George Washington University, Professor Douglas Evans, looking at the tactics that commercial marketing is using and applying this for public health. And I'm trying to get him to speak in one of these webinars, so it could be a segue to this interesting conversation. And in the next few weeks, this season, let's say, we have several speakers that want to talk about commercial determinants of health and how the role of advertising influences the agenda and the discussions we have in public spaces, private spaces, online, in offline. So I thank you very much again for your contribution. It's very much important to keep the discussion about this.
You're welcome. Thanks for having me.
Yeah, so I think we are 3 minutes before the close, and just want to remind everyone that we have our next webinar on the 8th of October with Dr. Nathan Manny from the University of Edinburgh. Is going to talk about, again, commercial determinants of health applied to content analysis and looking at how this can be used in public health. I put the chat in the chat the next invite, and I'll also post the link for the webinar series. And as I mentioned before, this meeting was recorded, so will be posted on YouTube channel, and where we can find all the other recordings for the previous edition of this webinar series. All right. Thank you very much for your attention, and I'll hope to see you next time.